Hello everyone. This week we will explore psychological models of substance misuse. We will talk about cognition, information processing, learning, social learning, rational, or planned behavior, developmental, psychodynamic, attachment, self-medication, personality, psychopathology, expectancies, and cravings theories. Let's talk about cognitive processing. Cognitive processes deal with the link between what a person perceives and how people interpret a situation and how they respond, or behave. On this picture, you can see a bear. The bear is the stimulus. Some of us will think this is dangerous, others will think this is awesome. Depending on how you interpret the situation, you might either try to run away, or stay and watch the animal. Substance use can impair our ability to recognize risky situations. As a result, people can get into accidents or otherwise endanger themselves under the influence of alcohol or drugs. Cognitive behavioral therapy, CBT, and other cognitively based interventions center on helping people reinterpret situations, cues, and stimuli, and develop new behavioral responses to those cues. Information processing. Information processing deals with the way individuals take in, meaning, perceive, organize, store, and retrieve the information. When something happens, this something represents a stimulus. A person can perceive that even through their five senses: seeing, hearing, taste, smell, and touch. The perceived information first moves to the short memory, for 20 to 30 seconds, and then it either gets lost or transferred into the long-term memory. When people learn new things, it happens in a certain context. For example, a person likes eating steak and drinking champagne. They feel relaxed and calm. Then they quit drinking. Next time they relax and eat steak, they remember they used to have champagne with it. The feeling of being relaxed and the steak are the cues that trigger the retrieval of memory about drinking. It can influence the subsequent behaviors. Some people will learn new behaviors, like maybe having water or juice with the steak. Other people will relapse into drinking. Let's review the classical conditioning theory. In Pavlov's experiment, the dog has been subjected to a special way of learning. As any other dog, this dog was hardwired to salivate when tasty food was provided. The food is called unconditioned stimulus, salivation is called unconditioned response. When the bell rang, the dog would not salivate. And why would he? Next, Pavlov gives the dog his favorite food while ringing the bell. There are now two stimuli presented to the dog. As before, the dog produces the unconditioned response, he salivates because he likes that food. But now the dog has included the bell into the picture of nice food. Earlier the bell was a neutral stimulus, but now the bell has become the conditioned stimulus. From this moment, the dog begins to salivate when the bell rings. Even without his favorite food. This is called conditioned response. Now you know why alcohol manufacturers put an extra effort in making beautiful whiskey and beer bottles and glasses with unique features and designs. The hope is that these glasses will become conditioned stimuli and encourage people to engage in consuming their products. So, what's the difference between classical and operant conditioning? The operant conditioning is a learning process, in which the consequences of a behavior determine the likelihood of repeating that behavior in the future. The punishment is used to decrease the behavior. Punishment can be positive and negative. A drunk driver who is given 90 days in jail is an example of positive punishment. A drunk driver whose license is suspended for 2 years is an example of negative punishment. The reinforcement is used to increase the behavior. A member of Alcoholics Anonymous, who is presented a coin after remaining sober for 10 years, is an example of positive reinforcement. A person continues using drugs to avoid painful withdrawal, is an example of negative reinforcement. Social learning theory. Social learning theory involves observing others' behavior and the consequences of others' behavior, and using these observations to guide one's own behavior. Research shows that children as young as 3 years of age are able to observe and learn patterns of alcohol use in their families. They also learn that when mother gets upset, she can have a glass of wine and calm down. This sets an expectancy associated with the alcohol use. If upset, have some wine. Another example is when sometimes people don't know how to behave in a certain situation. They look at others and do the same thing. Many adolescents use drugs because their peers do it, which is the process of social referencing. Theory of reasoned behavior. Reasoned behavior refers to the tendency of individuals to calculate costs and benefits associated with a behavioral choice. Typically, when making a decision, whether or not to use alcohol, cannabis or some other substance, an individual would engage in an internal mental debate about the possible positive versus negative outcomes. On the one hand, they can enjoy friends and positive feelings. On the other hand, drugs are expensive, and they can get in trouble with family or police. Developmental theories. Relatively recently, scholars have begun to argue for viewing substance use disorder within a developmental framework. The idea behind this approach comes from the fact that genetic and neurobiological risk factors tend to interact with the exposure to adverse life experiences and protective mechanisms. Together, they result in a certain pattern of behaviors and substance use over time. On this slide, we can see that the earlier children start using alcohol, the higher is the risk of developing lifetime alcohol dependence. This slide shows that young adults have the highest levels of binge alcohol use. Over time, many people transition to family and employment. Those who continue high-risk alcohol use may not survive to be included in the later age groups. The adolescent brain undergoes dramatic developmental changes and functional revisions as part of normal development. The synaptic and myelination revisions do not occur evenly and concurrently throughout the brain. For example, the areas responsible for inhibitory control over behavior do not keep up with the same pace of change as areas responsible for initiating behavior. This explains why adolescents might behave more impulsively and exhibit less inhibitory control over their behavioral choices. During the 1950s and 1960s, Morton Jelinek concluded that alcoholism follows a natural course over time, a course characterized by 4 qualitatively distinct stages: pre-alcoholic, early alcoholic, middle alcoholic, and late alcoholic. More recent studies demonstrated the dynamic, constantly changing nature of addictive behaviors. A typical substance misuse trajectory begins during adolescence or emerging adulthood, declines or escalates during emerging and early adulthood. Then, it either declines or extends into adulthood, possibly but not necessarily meeting criteria of a substance use disorder. This figure shows the multiple trajectories and the iterative nature of the possible trajectories. For example, a person can move back and forth between controlled, risky, disordered drinking, and no alcohol use. Let's talk about 4 theories of psyche that are linked with substance misuse and substance use disorder. In a psychodynamic theory interpretation, addiction is not viewed as being a disease in and of itself, but as a symptom of intrapsychic conflict, unresolved psychological tension, or psychological turmoil. The primal aspects of personality, called the id, include both negative and positive feelings. The superego develops through learning and experience. We learn that some behaviors are not acceptable. We feel guilt and shame. The ego develops over time as we continue to learn. It acts as a referee between the strong act urges that come from the id, and strong inhibit pressures, which come from the superego. Ego helps balance out pleasure and control. Some people use alcohol or drugs to numb the feelings triggering the response from id. Another psychoanalytic interpretation of addiction, particularly for cigarette smoking and drinking alcohol, is one related to the concept of oral fixation. If something goes wrong with the child at the orality phase of development, then a portion of libidinal energy becomes stuck in the oral zone. The person will spend a lifetime trying to satisfy their need for oral stimulation, which includes putting things in the mouth, chewing, or sucking on things, using cigarettes and alcohol. Attachment theory. As explained in the early works of John Bowlby, infants and young children, in the normative course of development, form attachment relationships with others central to their physical and emotional survival, their parents, siblings, caregivers, pets, and even special transitional objects, like a blankie or a stuffed animal. These psychological attachments allow someone to have the sense of security in a great big, unpredictable world. Within these attachment relationships, individuals begin to make sense of their social world. Sometimes, attachment relationships are disrupted or dysfunctional. People may come to rely on drugs or alcohol as a means of coping with these gaps and the associated negative feelings and sense of detachment. Past clinical literature discusses a phenomenon called the addictive personality. In theory, individuals are predisposed to develop a substance use disorder, or addiction, by virtue of possessing certain personality traits. Studies show a higher risk of using and misusing substances among adolescents who have angry defiant personality types, as well as the thrill-seeker personality type, sometimes called the type T personality. According to DSM-5, a personality disorder is an enduring pattern of inner experience and behavior that deviates markedly from the expectations of the individual's culture, is pervasive and inflexible, has an onset in adolescence or early adulthood, is stable over time, and leads to distress or impairment. Some people, for example, people with antisocial personality disorder, may show symptoms of impulsivity or failure to plan ahead. They might fail to conform to social norms, with respect to lawful behaviors, recklessly disregard safety of self or others, use deceitfulness, lie and con others for personal profit or pleasure. Such behaviors often correlate with substance abuse. Research also shows that people living with borderline personality disorder are more likely to engage in impulsive behaviors and substance abuse. People with some other personality disorders may feel uncomfortable around other people and abuse substance as a coping strategy. Using substances for coping is fairly common among people living with depression and anxiety. It's important to keep in mind, however, that people who live with mental illness may or may not develop substance abuse problems. Likewise, people with substance abuse disorder do not necessarily have personality disorders or mental illnesses. Expectancies and craving. Expectancies are beliefs individuals might hold concerning what using alcohol or other drugs will do to, or for them. In most cases, children at young age develop ideas about what substance use does to people, just by looking at their own parents. Here are some examples of expectancies. Stop the video for a moment and read. As you see, people expect multiple experiences as a result of drinking, such as relaxation and tension reduction, increased social assertiveness, and physical and social pleasure. As previously discussed, internal and environmental cues can become craving triggers through classical conditioning processes, with exposure to those triggering cues, increasing the risk of using substances again. This is called a cue-induced response. Cues or triggers may involve any combination of the five senses: sight, sound, taste, feel, and smell, or internal states, such as anxiety, loneliness, boredom, depression, or mania. For example, one woman in treatment for a substance use disorder described loud rock music as a personal trigger for her craving to use alcohol and marijuana, because she learned to enjoy these substances at rock concerts. The cue-induced response can be changed, for example, by using the cognitive-based therapies. One skill addressed in these therapies is for individuals to learn to identify their own personal triggers, or cues, and develop strategies to 1. Avoid potentially triggering situations. And 2. Respond differently to them when they cannot be avoided.